Hey Simon, Hung. I'm not able to join video, so
And Simon, this is Mary Ann. I'm unable to also.
Give it a shot in just one moment. Let me update settings. There we go. Well, not seeing Ronnie Sure unless he's listed under a different name on the attendees list. But what I, what I can do is send him a note and we can just get going. And if
Yeah, I think that'd be a good idea. Okie doke. Well, maybe while Simon's doing that, I can go ahead and kind of get us kicked off here a little bit. So first of all, just want to thank everyone for coming out. Maybe we can, for the panelists, just go and do a quick round of introductions. I know most of us are probably familiar with everyone, but I don't know that everyone has met all the other PDAB members or advisory board members yet. So I can start and I'll start off with introducing the HCA staff. Then maybe we can do the PDAB board members that are here that were able to make it, and then the advisory board members can go around. So. Just for my starting with me, I guess. My name is Mike Neuenschwander, the director for the Prescription Drug Affordability Board here with HCA. And so it's really exciting to be here and start up this new advisory board, which will be helping our PDAB board as we move throughout these next phases of the process. So maybe Simon, do you want to go next? And then the data team can introduce themselves.
Yeah, happy to. Hey everyone, I'm Simon Borman. Probably recognize me from the board meetings. I'm the policy analyst on the team and helping Mike get this all set up. And I'll be working pretty closely with you all on the advisory group to get this started and then to coordinate the work moving forward. Looking forward to working with you all.
Great. Jingping, you want to go next with your team? Or Jingping might not be on. Kelly and Marina and Sumaya.
Sure, I'm Kelly and I'm the PDAB data analyst. So I pulled the data I pulled the drug data that you're all going to see soon.
Great. Marina?
Yeah, and this is Marina Suzuki. I'm a health economics research manager, so I'll be helping with the affordability review later.
Great. And Sumaya?
Yeah, hi, I'm Sumaya Sebi. I am Pharmacy Data Analytics and Research Manager.
Great, thank you. And then I think we'll round off the HCA staff, last but certainly not least, Ryan.
Good afternoon. I'm Ryan Bistresi. I'm the Assistant Chief Pharmacy Officer here at HCA.
Great, thank you so much. So now let's hop over to our board members who are able to make it. So Mary Ann, do you want to start off?
Sure. Good morning, or I guess good afternoon. Hi, Mary Ann Linda Blad, and I chair the board for the Affordability Board. And I just welcome you all today to this meeting.
Great, thank you so much. Doug?
Hi, everyone. Doug Bartheld. I'm board member. I'm a research associate professor at University of Washington, health economist. Thanks.
Great, thank you so much. And Hung?
hey, good afternoon, Hung Trong. I'm the board member for the PDAB. Just really appreciate you guys joining and helping us to do this work.
Great, thank you so much. And I think Eileen is another board member. I think she's double booked with another public meeting event that she had to attend. So I believe she'll be here a little bit later. So now to the stars of the show, maybe we can go around here for the advisory group. And I guess Daria, would you like to start?
Sure, thank you. Daria McGrew, I'm a Director of State Policy for PhRMA, the Pharmaceutical Research Manufacturers of America. I have a background in healthcare policy and legislative expertise working in the legislative arena. I cover the Northwest states for PhRMA, and prior to working in healthcare policy, I was actually a researcher studying cancer biology and vision disease in the laboratory. So I switched from laboratory research to healthcare policy.
Great, thank you so much. Jim Freeberg.
Good afternoon, Jim Freeberg. I'm the Executive Director of the Patient Coalition of Washington, which unites the state's leading patient advocacy groups. It's an advocacy coalition that just focuses on state healthcare policy. In addition to my patient advocacy work, I'm a dad to two young girls. One of them's got her 5th birthday today, which is exciting here. And I bring that up in that she has asthma. And so from a personal experience, trying to make sense of what her inhaler costs every month just like confuses me to no end. So I look forward to working, and not necessarily on that issue. I know that's a little bit of a sideshow, but look forward to working with you all.
Great, thank you. And Tim.
Good afternoon. I'm Tim Lynch. In my day job, I'm the Chief Administrative Officer for Multicare Health System, and I'm also a pharmacist, and I've worked in healthcare for going on nearly 30 years. So eager to be part of this group.
Great, thank you so much. And I think Ronnie Sure hasn't hopped on yet, and Laura Berry, our other two advisory board members. Laura had a conflict. She's currently on a flight right now. But we will catch them up here and get them all with the rest of the group here soon. So to kind of kick this off here, thank you very much for the introductions. It's great to learn more about everybody and kind of meet the team. As we get going, really one of the key purposes of the advisory board is to be able to get input from additional stakeholders and try and gather more insights, more points of view as the board is working to try and make some of these decisions. We'll talk about this more later, but one of the big steps that we're at right now with the board is trying to work on how we're going to select the various drugs that we'll be reviewing. So just trying to even start with that basic first step of how we're going to pick these and then moving on. Just kind of as a very high level overview, and Simon will go more into the details, but the Washington Prescription Drug Affordability Board is a rather relatively new entity. So we are kind of building this ship as we're going along and trying to figure out all the different pieces of this puzzle as we implement new policy. I think especially in the world of policy implementation, there's a whole lot of things to consider, a whole lot of factors and pieces of the puzzle that we're trying to piece together in order to solve this problem. And Jim, I appreciate you sharing kind of your personal experience of things that help you motivate this. I have two sons as well, twin boys, who need some additional medication and some help. They have some special needs. And so things like this are things that I'm also very passionate about as well, and reasons why I think this is a great effort for us to be involved in. And some of those personal things really, bring issues like this to the light and the forefront of, hey, can we try and make this better? What can we do to solve this problem? And there might not necessarily be a lot of easy answers or quick answers, but I think doing part of this effort is a reason why we're here and working on this. So with that introduction and welcome, we'll kind of kick off into the next piece, which Simon will take over and run through kind of the mission and objectives of this advisory group. and kind of walk us through some of the basics of what's guiding us as we're doing this, talking about our responsibilities, and then some of the administrative stuff towards the end of just how and where and when we want to continue to meet as we move through the next steps of this process. So, Simon, with that, I will pass it over to you, and you can take it away.
Sounds good. Thanks, Mike, and thanks everyone for going around and introducing yourselves. Great to officially be meeting. So just going to walk us through a little bit of the history that brought us to where we are with the Prescription Drug Affordability Board, both the history within Washington State and just kind of zooming out and seeing what other states have similar programs. For the PDAB board members, this presentation will look very familiar. We went through all this in our first meeting a year ago. From there, we'll then get into a little bit more specifics on the advisory group, and you probably saw the policies that I shared with you and that are posted on the PDAB website. A lot of this language is pulled from those, but just broken down into chunks that we can then discuss. We'll go over kind of your mission, your responsibilities, and then at the end we can open it up to questions and just get a sense of any lingering thoughts. So a little bit of the history within Washington. There are two other programs similar in nature in that they're focused, they're housed within HCA and focused on price transparency. So we have the Drug Price Transparency Program, and then we have the Healthcare Cost Transparency Board. And we have folks on the line here for who want to, and the questions kind of dive deeper into what each of these groups do. But really the main thing to know is that these three different entities, the Drug Price Transparency Program, the Healthcare Cost Transparency Board, and the newly established Prescription Drug Affordability Board, work together to some extent on the back end in terms of sharing information and trying to move from understanding the cost of things as they are, and then in the case of the Prescription Drug Affordability Board, institute policies that will bring down those excess costs in the long term. Zooming out across the country, so many of you may be familiar with NACHP, the National Academy for State Policy. They had put out some model legislation a few years back around what a prescription drug affordability board could look like. And then in different states across the country, you've seen that legislation taken up, revised, amended in some way, and then enacted. And so you've got these 8 states so far that have enacted a PDAB, and then a few other states that have enacted similar or adjacent efforts, like Massachusetts or New York. And our team has been working with these different teams just to share learnings across states. And what's been nice for us is that there are different stages of development. So Colorado is ahead of most of the states. I think Minnesota is maybe the newest one. And so we've been able to learn from some of the lessons of states that have already put in place affordability reviews. And so we're taking a slow, steady, and conscientious approach to not repeat any kind of efforts that other states have made that didn't go the way they wanted. Not one important detail is not all of the state boards are permitted to set upper payment limits, but ours is. And so that'll come, that'll be important later down the road. So a little history of our PDAB. The legislation was passed in 2022. As I said, it's based on this NACHP model legislation, but amended. So there are some unique elements of our legislation that you don't see in the other states. We have a 5-member board that's appointed by the governor. You've got some of the members on the line here. Another one will be joining a little bit later. And then as Mike mentioned, one of our board members is a conflict today. Those terms are for 5 years, and there are strict limits on conflicts of interest. And so each of these board members had to fill out a conflict of interest form, and they haven't worked for an industry group related to the space. Those, we point that out because the conflicts of interest prohibition for board members is different for the advisory group members. We actually have a space specifically for folks with industry experience. So we get that perspective as well. So diving into the meat of things, really the goal of the Prescription Drug Affordability Board is to put together a list of drugs that meet certain prerequisites that are set out in the legislation. Then from that list of drugs to select certain drugs to run affordability reviews on. And then for those drugs that are determined to lead to excess costs, potentially implement upper payment limits. So the affordability reviews, as I said, there's certain parameters that are laid out in the legislation that the board uses to put together this initial list of drugs. So you've got brand names and biologics, the wholesale acquisition cost of $60,000 or more, or price increase of 15% per year, or 50% over the last 3 years. And then biosimilars that had an initial acquisition cost is a little bit funky wording, but not at least 15% lower than the reference product. And generics with a wholesale acquisition cost of $100 or more for a 30-day supply that had their price increase 200% or more in the previous year. So our data team and our pharmacy team have worked together to put together this initial list. And then what we're moving to now as a board is to take that initial list, narrow it down further, and as I said, potentially select drugs for affordability reviews next year. In the legislation, it's laid out that we can conduct up to 24 affordability reviews a year. That is quite a lot. And so the first few years, probably the board will do significantly less, just a few to start, get their bearings, and then increase the number over time as they kind of get the processes down. The goal is to determine if the drug will lead or has led to excess costs. And then there are certain factors that must be considered. And then as we'll get into later, certain factors that can be considered that are laid out in the legislation and in our regulations. And so we can dive into those as well. And then, as I mentioned, the end goal of all of this, kind of the last thing laid out in the legislation is that the board can institute upper payment limits on those drugs that they deem to lead to excess costs. These upper payment limits apply to payers within the state that fall under a certain regulatory scheme. So it's state payers or those plans that are regulated by the Office of the Insurance Commissioner. As you see here, ERISA plans, like large employer-sponsored self-funded plans, can elect to be subject to the UPLs. Federal plans, purely federal plans, are not subject to the UPLs. But within Washington, that's still a large chunk of the state that falls under one of these regulated plans. And this can't go into effect until 2027. And so, as I mentioned, this next year, the focus will be on selecting drugs, running affordability reviews, and then slowly laying the groundwork for what an upper payment limit could look like if one is to be administered. So getting to your role, the advisory group, the vision is to help out the Prescription Drug Affordability Board in selecting drugs and then providing guidance around evaluating those drugs during the affordability review for whether or not they lead to excess costs. I'll skip this kind of more generic paragraph, and I'll dive a little bit deeper later on in this PowerPoint into what the specific goals are for each of you. But just to speak to the membership a little bit, so what you all sit on is what we've called a core advisory group. So a stable group of folks that will be around for multiple affordability reviews. And then for each of the affordability reviews, we'll also seek out and recruit supplemental advisory group members. So patients and patient advocates for that specific condition or taking that specific drug, healthcare providers who specialize in that condition or in that drug. And so through the core members, we'll hope to get a general sense of kind of these different factors that go into drug affordability. And then from the supplemental group, getting a more specific sense of what does it mean in the context of that drug or that illness. So as I mentioned, just a little bit more specifics on the advisory group's roles. The responsibilities are to attend these meetings, so congrats, check number one, and to attend the PDAB meetings, which are on alternating months. And those you can, as with this, you can attend virtually, or if you're in the Olympia area, you can attend in person. And then the next goal is to submit a report to the PDAB for each drug that's undergoing an affordability review. And the parameters and the outlines of that report are something that we would love to discuss with you all to see what you think would be a helpful way to format this information. And we'll also discuss with the broader Prescription Drug Affordability Board to get their sense of what would help them. And then throughout this process as well, we presume that there will be points where the board will have specific questions, maybe not wanting to wait until the final report is done. And so, those might be sent over to you as well to do some additional research or to provide your guidance. And as I mentioned before, there's the short list of the factors that must be considered. And then this is a longer list of factors that can be considered as we conduct the affordability review. And these are also listed in the legislation or the regulation. I'll have to go back and look, but I believe it's in the legislation. And so this presentation has been shared with you, and we can also find this list elsewhere. Great. So that's a quick rundown of the role of the advisory group and kind of what we'll be doing over the next year or so. The goal in the immediate term is following this upcoming November 13th PDAB meeting, we'll task you all with reviewing the drug list as it stands now, and then ask you to draft some recommendations for how the PDAB can start to narrow down that list. We have one approach that we've been working on, and would love to also get input from you all on other ways to think through selecting drugs for affordability reviews. Cool. So I'll break there and see if anybody has any thoughts or questions before we move forward. Okay, not seeing anything, and obviously you all have my email and my contact, so we'll be in touch if more things come up or any questions come up. Go ahead, Tim.
Yeah, well, I apologize. Will these slides be shared, or I think I was trying to find what you sent previously, and for some reason maybe I didn't scroll down far enough. I saw the agenda, but I didn't see all the other stuff that you went through today. So I'll take a look at it, but I didn't know if you could send it out again just in case.
Yeah, I'd be happy to. I'll follow up to this meeting with these materials and links.
Sorry about that.
No problem. And I'll send a link to the website, which you can find the legislation and the regulations there as well for further reading. So you got a sense of the mission and objectives and the responsibilities of the board. Then just moving into some more tactical elements of this meeting. One would be getting a sense from you all of a recurring meeting cadence. And so as I've mentioned, the Prescription Drug Affordability Board meets every other month during the odd months of January, March, etc., on the third Wednesday. I know that if we were to do the even months on that Wednesday, then we would conflict with other state board meetings, which some of you may join. And so either now, if you have your calendars available, or if you prefer sending an email afterwards, we can maybe nail down a time that each month we meet on the same day. And then after that, the next technical thing would be to vote on a lead within this advisory group, just a point of contact to kind of help guide some of these meetings and share information more broadly. So I'm thinking now. Oh, go ahead, Mike.
Oh yeah, and I was just going to say, kind of maybe the idea with the meetings every other month opposite the board is, as the board is working on stuff, for example, this next month, our goal is to try and present a dashboard with a sorted, organized list with the weighting criteria that the board has selected to have, show that to them, and then, following them talking about it, and, us approving different actions during these board meetings, then being able to send that to the advisory group, kind of as a follow-up with any, additional information that we may have or questions that the board may have. So that way at the next board meeting, the following month, we can bring whatever ideas or recommendations that the advisory group has to the board. So kind of staggering it so it's a back and forth sharing of information.
So I'm thinking, since we've got two of the advisory group members who aren't here today, maybe I'll circle back over email, and then that way we can get everyone's take on what days of the month work for them, and then we can set a recurring date. And then voting on an advisory group lead, we can either do that now if any of you are eager to be the kind of the point person for the advisory group, or we can hold off and ask the other two members if one of them is interested. Daria, Tim, or Jim, are any of you, enthralled by the prospect of being the advisory group lead?
I wouldn't say enthralled. Curious is maybe a word. I'm a little interested in more of kind of the responsibilities. I mean, I understand it's kind of a focus point, but if you could just elaborate a little bit more on kind of additional time expectations, or, is it kind of running some of the meeting?
I think so. Not a massive time commitment, but maybe doing some of the more formal elements of running the meeting. Like if you watch the PDAB meetings, Marianne will kind of walk through the agenda and will call for a vote on certain matters, or ask for discussion on certain matters. So really just being kind of the more formal leader of the meeting. And then, potentially helping with if we're going to make a decision on how to put together a report, adding some weight around being the final one to compile it and send it over to the HCA staff. Legwork though, scheduling and putting the documents together, that'll be us, the HCA staff.
Yeah, and additionally, maybe if there's a presentation or something or information that the advisory group needs to share to the board, just having that single voice, share that information rather than trying to split it up amongst 5 people.
I'm interested, but I think it makes sense to hear from the other 2 board members before we make any formal appointment, if you guys are okay with that.
Yeah. And another thing too is, I don't envision this being permanent forever and ever. I'm very much open, if we need to adjust things, adjust meeting dates or times, or adjust roles, happy to help coordinate around that too. So this isn't set in stone for forever. We can start, and then if we need to tweak, like for example with our board, we've been updating our policies as we go. We've been figuring it out as we go. So I think there's opportunity for other people to be involved as well. So just kind of that, so there's not the pressure of I'm committed for the next 20 years to do something. So.
Makes sense.
And maybe kind of in terms of coordinating the meetings, I don't know, maybe just as a starting point, if maybe the first or second Tuesday of the off month, we can kind of start there. It's, today it worked for most people. Obviously, someone was traveling, but yeah, maybe Simon can send out a survey in terms of trying to organize specific dates that definitely do or definitely don't work for somebody. So, okay. Any other questions, thoughts, or comments from the panelists?
Nothing right now for me.
Okay. And so I guess really kind of the big stuff that's going to be coming up then is at the next board meeting again, our goal is to try and uh, have a more detailed dashboard of the list of drugs and then go through as the board was talking about and ranking those in trying to come up with that ranking system so we can see that. So at the next board meet or at the next advisory group meeting, I think that'll be really kind of jumping into the deep end there and taking a look at that and starting to get the feedback from the group on the drugs that we have and the next steps in terms of selecting them. So this meeting is very much kind of an introductory, setting the foundations, administrative oversight, and the basics. But next meeting, that's kind of the plan as we're moving forward. So any other questions around that? Okay. So I think as we kind of move towards the end, I'm a firm believer in short and sweet. And no need to drag things out unless we absolutely have to. Simon will be working on with the advisory group in terms of setting a consistent meeting date. These meetings will keep them virtual that way, just for the ease of everyone across the state attending. And then we'll get this information in the meeting recording out to the two group members who weren't able to make it. And we can discuss leadership if they have no interest, and then we can kind of, or any interest rather, and we can move on from there. So, Simon, anything else on the docket that we need to do?
No, I think that's perfect. The only other thing I would add is there are, and this is something that has been discussed on the staff end, but maybe hasn't been shared publicly, is that there's an Open Public Meetings Act that guides kind of the ways that HCA holds meetings. And since this advisory group is not a decision-making body, it doesn't fall under that act. But we want to still provide this for the public to take part and respond. So that's why we are doing these meetings, Zooming them publicly, recording them. We're posting the recording on our website. And then the time that we'll set aside for public comment will be the time during our PDAB meetings every other month. That way it's during an official open public meeting. So this is really just an announcement for all of the folks who are attending that if you have comments, please write them down, send them in to the PDAB team, or join the next PDAB meeting and say them aloud then. And then Tim, I see your hand raised.
Yeah, thanks, Simon. So just to clarify, so we're not under the OPMA as an advisory group to the PDAB. And therefore, all of our email communications, if we call each other, that's not part of the OPMA if we're talking about the work related to this advisory group. Is that a true statement?
So I think there's a fine line where the emails are still public records that can be part of a Public Records Act request, but the meeting have to be open public meeting elements. So we don't have to have an in-person element for this. We don't have to have a public comment period for this meeting, unless someone were to, unless this were to be a meeting of the PDAB and they were to make a decision about something. But we try and hold those decisions until the official PDAB meeting. Does that make sense?
Yeah, I used to be on the Washington State Pharmacy Commission, so that's why I'm just trying to clarify what, are we subject to the OPMA? And what I heard our meetings, if we're meeting as a smaller group, those will be public, right? And they're like the meeting that you said, for our next internal meeting for the advisory group, those are subject to the OPMA, and any email communication would also be subject to the OPMA, or no?
So the communications these meetings will be held publicly, like this one, where anyone can join. The communications between the board members, I think, can be subject to an open records request, but they don't constitute an official open public meeting, if that makes sense.
Yeah. And we can triple check on that just to make sure and clarify and kind of circle back around. But yeah, so we've worked with our legal team, so this is not the meeting itself is not an open public meeting, but yeah, we can double check on the email communications just to make sure.
Yeah, and there's restrictions how many people can get to. I mean, so I just want to make sure that we know what we're subject to, and also what the guardrails are as far as our communication and how we communicate if we need to.
The advisory board is advising; they're not making a decision. It's the PDAB which is making the policy decisions, and so as such, the advisory board, in this capacity, for example, talking here is not OPMA. But yeah, we'll double check. Internal communications between advisory group members, what that would mean. So
okay.
I think Mike made the key point is that this group, the advisory group, is not taking an action that is defined in statute. So you're not the ones selecting the drugs for a review or setting the upper payment limit. You're providing advice to the board in which the board then considers. And that's kind of where that differences on why the board meetings are OPMA and these advisory groups are not, is because that action cannot happen within the authority of the advisory group. In regards to the email, I think that might be FOIA, so Freedom of Information Act. So again, that's something that we'll look at, but it wouldn't be state OPMA.
Great question, Tim. It's those little details. Again, as we're doing this all here for the first time, we're figuring it out here, but come a year from now, we'll all be seasoned pros.
Yeah, and if it is subject to FOIA, then maybe we need to think about what email addresses we use. I know we won't have a DOH email, but not using work emails, because that'll open up potential exposure as well. So that'd be great to get that information.
Great. We'll do that. Okay. Any other questions here? Wonderful. Well, I think then we have a couple of tasks on our end in terms of just coordinating some of the next steps in terms of calendars and whatnot. So look for our emails coming out here in the near future. We will be prepping for our next advisory board meeting with the goal of taking a look at the drug selection criteria and the drugs themselves with the dashboard, and looking to get into some great work here over the next couple of months with the advisory group. And I'm sure the PDAB board members will be grateful for all of your help and contributions. So again, as Simon mentioned, if you guys have other questions, feel free to ping me at any time, and we'll look forward to seeing you here in a few weeks.
Great. Thank you.
Thank you.
Thank you.